The government has pushed us to a situation where we have to keep asking for the basics.
Even as the COVID-19 pandemic continues to take a toll on medics, with a number of them having succumbed to the disease, officials from the Kenya Union of Clinical Officers KUCO have blamed the national government through the Ministry of Health for not fulfilling their role in ensuring the safety of health workers in the line of duty.
All the policies that have been put in place by the Ministry of Health have not been followed.
This, they say, is the main reason behind their 14-day strike notice issued today.
Kenyans are going to be having a very hard time with a pandemic and not having people to help them when they come to the hospitals, because we are going to withdraw our services until our demands are met.
Si vizuri niendelee kufanya kazi kwa ajili ya kujitoa na niweze kupoteza maisha yangu iwapo ningeweza kuzuia.
Lack of protective equipment has led to an increase in fatalities among clinical officers. 55-year-old cataract surgeon David Makori, the latest to succumb to the virus on Saturday.
We cannot negotiate on matters pertaining to the sanctity of life of our members and colleagues. Allowing the status quo to continue is akin to accepting that it is okay to sacrifice clinical officers and other medics when indeed this can be avoided.
David was among the vulnerable group, with the union's General Secretary George Gibore saying such fatalities can be avoided by exempting the group from duty.
All healthcare workers belonging to the vulnerable groups, that is the pregnant, those who have 55 and above of age, and also those with pre-existing conditions and diseases, be exempted from active duty.
Among their woes is the provision of N95 masks each time they are on duty, provision of medical covers, as well as hiring of an additional 3,000 clinical officers under a permanent and pensionable basis.
We must depoliticize the health sector, and by that, a health service commission will be coming to depoliticize, so that we are not managed according to the will and wish of political entities but by a professional body.
Kenya has over 72,000 infections. These are the guys who are on the front line, the doctors and medical staff. They should be supported and encouraged and given what they require so that they can continue to save lives.
Saddened by the situation in Vihiga County, Gibore revealed that 567 clinical officers employed under the universal healthcare in the region have not received salaries for 13 months now.
Including those who are working in isolation center, they have been forced to share meals with the patients. This is the painful situation that the government is actually subjecting these healthcare workers to.
Ben Kirera, K24, Punchline.